Hello, welcome back to Deconstructing with Dawn. It's been a minute or a month since I have updated you guys with anything. I went through 3 surgeries, pretty significant major surgeries in a 4-week period, I think it was. And I'm still healing and I look like a wreck. This is lupus rash. This is what my natural face looks like. But I wanted to share some things with you guys. In particular, the last surgery that I had, I could not find but 2 videos that were relevant to my experience that I was trying to get some information about, like what's going to happen, what do I do afterwards, that kind of thing. And so I thought, well, I'll just create my own video and let you know if you're looking out there for this type of information that it would help you. So this is not a genealogy video. This is not really a unboxing video or anything. It's more of a surgical update of the 3 surgeries I went through. The first surgery I had was on January 29th. It was a revision to a surgery that I had October 2017, in which I had a tumor removed with an ovary and a fallopian tube. So I had the whole thing removed because of this tumor. It came back non-cancerous, but it was a fast-growing tumor. Within 4 days, I developed an infection, had to be hospitalized for like almost a week. And from that point on, it hurt in my left abdomen from that point on. For a whole year, it hurt. Finally, I had a CAT scan done by an oncologist because they were checking to see if it was maybe related to non-Hodgkin's lymphoma, which I experienced in my neck and my breast. And I was clear of all of lymph nodes, but this mass showed up in the CAT scan. I had a biopsy done. It was just a giant cell tumor, no big deal, that kind of thing, but the pain was still there, and they couldn't understand, and it was bigger than what the original tumor was, and they couldn't understand why it was so painful if it was just a basic, it wasn't any big deal. So the original surgeon removed it on January 29th, and when he was actually in there, what it turned out to be is the tumor was wrapped in scar tissue and had pocket of fluid in it. So it was not cancerous, and it was not at all the same tumor that the last one was. But what the real problem ended up being was that I think he said 10 centimeters, I'm not sure, 10 centimeters of my bowel was stuck to my pelvic wall, and that was because I had gotten adhesions from that infection. So every time I would stand up, there was just every day pain in this lower abdomen, and it was because of that. So he clipped it, released it, and it has been absolutely fantastic to not have that pain in the left abdomen anymore. And had we not continued to pursue this problem, I would have never known that my bowel was stuck. And he said it could have torn at one point, so I don't know what would have happened. I didn't ask because it's done. But so it's a good thing that we pursued removing that tumor, because it was actually more important than anything. So I have been fantastic. I believe I took 2 pain medications and that was it. I mean, it's been amazing recovery for that. I still have 3 holes in my stomach from it. 2 are now completely healed, but 1 still has a little stitch sticking out. So my shirts catch on the upper one. And if I'm doing laundry and I lean over the machine, that hurts. But otherwise, it's nothing. I mean, it's fantastic. The second surgery was on February 13th. I had a revision to a plantar fasciitis removal, a release. And basically 8 years ago, I'd had a tarsal tunnel release, which tarsal tunnel is the foot version of carpal tunnel. And I have non-diabetic peripheral neuropathy, and so I had one by one had to have every nerve severed except for my left one. At this point it's holding out. But when I had the right tarsal tunnel nerve severed, at the same time it had plantar fasciitis, so they released that. And from the get-go, I had developed scar tissue, or so we thought, for 8 years. For 8 years, I went through physical therapy, I went through shots, I went through exercise regimes, night splints, everything all over that you would treat plantar fasciitis for, they treated that for. And eventually, the last shots that I had, which I think were in maybe October, I think, I developed a reaction to it. My skin actually broke down, so I could not have any more shots. And that is common. You reach a limit of cortisone and that kind of shot. So I reached my limit. And so I had to be referred to a specialist because the doctor's like, I can't do this for you. So he sent me to a specialist. The specialist, one feel of it, said that's a tumor, not scar tissue. And so I had a plantar tumor. And he finally removed it on the 13th. It took months of wait, like 5 months, I think, of waiting Yeah, 5 months, I believe, before it finally got done. So that has been removed. It came back just a regular plantar tumor, no big deal. However, what that means to me is that was initially consulted for Cowden's disease, but because I didn't have any tumors in my feet, that was one of the final reasons that I didn't have Cowden's. I had something else, which is I don't even care about. But the Cowden's disease, now I have to be reevaluated for that because I do have a tumor in my foot, had a tumor in my foot. And that's one of the factors that you're supposed to be followed for. So my Lent, my giving up for Lent was no more doctors. I've gone through 4 weeks of hell, and I was not going to deal with any more doctors for Lent. So I have an appointment with the oncologist, genetic oncologist for after Easter. So we'll get that addressed. And if I have Cowden's, it really doesn't matter. It's a non-curable genetic cancer type thing, but I've already got all the problems that come along with it. It's no big deal, it's not treatment, so I don't really care. But that's just be one more thing on top of everything. But what I really want to share with you guys is that I had a turbinate repair done to my nose. It's called septoplasty, not rhinoplasty, but septoplasty, where I had to have cartilage to rebuild the turbinates in my nose. And that is because for 7 years I had chronic sinus infections, and I mean Z-Pak, taking Z-Paks because of my heart condition that I've had, which I've had 3 heart attacks. Having a Z-Pak, there's Roscoe. He's getting so big. I think he's 17 weeks now, but we love him to death, even though he's a baby shark. But anyway, for 7 years I had this chronic sinus infection, and the Z-Paks cause a AFib to you. And so because I've had the heart attacks, it's not good for me to take Z-Paks, and so it needed to be under control. I've consulted for 4 years, was consulting with different nose doctors to get this taken care of, and they would do CAT scans and say, oh, there's nothing in there, there was a polyp or something, and you had just chronic sinusitis or something, and just nothing would ever get done. So finally I was like, no, it has to get fixed. I cannot breathe out of my nose. So I went and saw this one specialist, and he's like, yeah, all you have to have is this turbinate repair. So he said, but I can't do it. So he had to send me to another specialist. So I think I went through 5 doctors over a 4-year period before somebody finally recognized the deal. And basically I would suck in my nose, and because I had so many infections, eventually the nasal valves collapsed. This one in particular, you couldn't get any air through on my left nostril, and my right one, I didn't know it was fully collapsed, but they said it was fully collapsed. But to me, I could get a little bit of air in it. But anyway, so I had that repaired on February 26th. So from the 29th of January to February 26th, I had 3 operations, all major, operations. And to this day, my foot, my incision was 3 inches long, and there's still about 1/4 of an inch of open wound, like it will not heal. It's been a month and a couple days, but it's still open. So I have to treat that every single night. I have to wear a special bandage because I'm allergic to adhesive, and it's just a mess. But with the nose, that's where I'm going to get to 8 minutes into this. The nose, I searched on YouTube for turbinate reduction, turbinate repair, different keywords, and only 2 videos that I came across even kind of fit what I was going through. And so I thought, well, I'll just share what I've gone through. So what basically happened is it was done as an outpatient surgery. Mine was supposed to be done as an inpatient surgery, but they did it at a different location than what the surgeon normally works at, and he didn't want to admit me at that hospital. And why that is because Kaiser is there's just too many people on Kaiser, and the doctor's normal hospital, he had scheduled me, but it was going to be another month. And so then they called me and they said, well, if you would like to come in earlier, we can do it at this different hospital. But he didn't want to admit me there. So some people get admitted, some people don't. So that's that. I did not get admitted, even though I was supposed to, especially because of my heart situation. And I didn't. However, I was pretty angry about it that I didn't get admitted, because the after effects, I really think I should have been monitored. And so I'll go into that right now. The first thing that they do, and I'm going to put pictures at the end of this because they're gross. I look horrible, and I don't want to scare you right away. So I'll put the pictures at the end of this, but basically they went in and they had to take cartilage from the inside of my nose. I've never had any rhinoplasty done, so I had full brand new baby cartilage in there, and so they took cartilage from the inside of my nose and they had to build a turbinate, basically, which is the valves, and they just stick it, they go in to the inside of the nose and they just stick it into either side right here. So it's not the upper part. It's not the, oh my God, I look so bad. It's right here that they replaced. And I could feel underneath the skin, like if I touch this, it kind of like pokes into the inside of my nose, but they replaced it underneath the skin through here. They actually open up like a little valve kind of area right here and go up and stick it right there on each side. And so some people only have a single nose that's collapsed or whatever, but in my case, it was what, bilateral turbinate replacement. And so I now have holes that open up, and I'll show you a before of that where you could clearly tell, oh God, where you could clearly tell you can't breathe through my nose, and I still can't breathe through my nose. So that was the first thing. Then they basically, the surgery was only about an hour and 40 minutes. I got into recovery, and within 20 minutes, they were pushing me out the door. That was the most rudest experience I've ever had. I was incoherent. I was in horrible amount of pain. And I have a very high pain tolerance. I'm not even kidding you. Like, even with the foot surgery, I don't think I took any pain medicine for my foot surgery. I just took Tylenol. So I went through this, and I have a very high tolerance to pain, and she gave me one shot and said, okay, I'm going to give you Percocet, and then we're going to send you away. I'll give you another shot when you get into the wheelchair. She never did give me another shot. The first shot kind of took it away. She gave me Percocet by mouth, a pill of it, and because we lived 2 hours away from the surgical center, and it was horrible. It was absolutely horrible. We lived in a higher altitude, and the pain and the pressure of changing altitude was horrific. I mean, I should not have been sent home, but whatever. Maybe I'm just being a big baby about it, but it hurt. And the stuffing, like the pain in my teeth rivaled the pain in my nose. And eventually I found out that they actually nicked a nerve, and he said eventually it'll come back. But at this particular point, he nicked a nerve at the roof of my mouth, and it feels like how, you know, when you eat Captain Crunch, how it tears up your mouth. That's what it actually feels like you've eaten 5 bowls of Captain Crunch. It hurts to brush my top teeth like crazy. I had, one of my pictures, I'm not sure if I'll show it with you guys, but I look like a corpse, like a grayed and black corpse. Like, it was so bad. My lips were black up here. I had a black mustache, and they don't lift up your lip. Like, that's not what happened with me. They just went into right here and up. But I ended up having black mustache, black lip, and then underneath my lip. And I can't, that's as much as I can do. Like, I can't even, like, I don't even want to try it. It would hurt so bad. So anyway, so that's that. Then I had the first bruising came on this side. I just bruised all the way down my face like this, and then that started turning yellow, and then I started bruising on this side, and there's just a little bit of bruising left here. But what's really still bruising is this bags here. Those are still kind of blackish, if you can, I don't know if you really can't see, but yeah, there you go. It's kind of blackish underneath my my eyes, which is very common. That's a normal thing. And I have a headache nonstop, like, and I know that a lot of it has to do with sinus drainage and that kind of thing. Another interesting problem that I never even thought of is I had just gotten these glasses, I think in December, January, maybe, yeah, I picked them up in January, and what is that? Anyway, I picked them up, and they're prism glasses because of my visual loss. The doctor felt that if I had a prism, that it might even out my interior versus peripheral loss. And so what I did not anticipate is the pain of my glasses sitting on my nose, and the fact that they're not sitting properly anymore. So the prisms are not lined up. So I'm having a heck of a time seeing anything because the prisms are not lined up anymore, because my nose is now fatter up here. Not because there's also swelling, so I'm afraid to go get new glasses or the lens changed out because I don't know where my nose is going to settle. But right now it hurts. It caused me a headache besides a sinus infection type of headache, you know, like that kind of thing. And I still can't breathe. I had the packing in my nose. To get to that next avenue, as I got home, I'd already had the Percocet in me, and she said 8 hours later I could take another one. So 8 hours later I took another Percocet, and it was doing nothing. Like those pain medications did not work at all. I was in just a horrible amount of pain. I've been breathing through my mouth for 7 years, so that really didn't bother me. But the sheer pressure of my nose, I look like a pig. Like my nose was stretched out so bad. Like my skin is still reacting to it not having stuffed, from having the stuffing taken out, because it was just stretched within an inch of its life. And I've had to keep putting moisturizer on it because it's doing like a contraction. Now the dog's scratching the door. Because every video I do has to be interrupted by a dog, and I'm sorry for that. So the next day, I am in horrible pain, and I'm having just blood start to drip out of my packing. I was able to finally kind of figure out what was in my nose by that point, and there was 3 different types of packing devices. The first thing that was in there were these torpedo tampons. They're a common nose stuffing device. They just look like these little inserts of what's inside of a tampon. They're stuffed inside your nose with strings attached to your face, and they tape them down. And then there were these plastic that went, by the time I found out they were pulled out, they went all the way up to here. Like all the way up to here were these plastic air filled, not really air, yeah, they had like air, plastic air filled sticks in there. And I had straws, which the straws, I didn't know this, but apparently you're supposed to suction out the straws so you can gotta get air in your nose. Well, nobody told me that, but my daughter said as she was picking me up, the nurse said, you can keep rinsing her nose and suctioning out the straws. Well, my daughter told me that apparently, and I don't remember that. Later on, she told me, yes, I did tell you that. Anyway, so I never did it for a whole week. I never suctioned out the straws. But what ended up happening is as the packing started getting dried, well, that didn't really happen. The packing started dripping with blood, and I would have blood start dripping down my nose. And what they give you is they give you these little, they like cut masks up and all these like gauze things. And so every couple hours I would have to change these. And so it was just basically this like 4x4 gauze, and I would just have it like this, and then I would have this around my head, like that, and it would catch all the blood, right? Well, this hurt so bad because it was pushing my pig nose back that eventually when the blood some way stopped, I took that thing off because it was hurting my back of my head. Like I thought they took a graft from the back of my ear. That's how bad that stupid little mask thing hurt my head. Only on the right side though. And it was just shoving my nose back into my head with that big pig packaging. It would just hurt, excruciatingly hurt. So, but eventually I would just walk around and I guess some of the people have these taped to their faces, but because I'm allergic to tape, they couldn't do that with me. So maybe not everybody has to have this device, but that's what they gave me. So 1 week later, oh no, God, 5 days into it, for 7 days, I had 3 stuffs of packaging along with this stuff up my nose. And the 5th day, the right side started coming out. And I think it was the plastic thing that was coming out because it was like pushing everything down with it. And eventually about right here, it started hitting my nose to where my lips were I looked like I had lip injections. And it was like that, and it was hitting my lip. So I sent a message to the doctor. The doctor didn't respond to me. His nurse called and said, don't shove it back up. And I said, well, can I just cut the bottom off? And she's like, yeah, but don't shove it back up. So I like cut the bottom of all this crap that was hanging out of my nose. The left side stayed up there horribly, but it was kind of nice that my body was like, get this out. And so as it was shoving, it kind of like relieved a little bit of pressure on the right side. So I was secretly happy that it was falling out of my right nose. Finally, 2 days later, which makes it a total of 7 days, I go to the surgeon and he removes first they had to remove stitches in either side right here. There was just like a stitch that went across. And he removed that, and then he pulled these things out. And it did hurt, but the relief was just amazing. Like, I cannot tell you how fantastic that felt to have that stuff removed. He then suctioned me with blood, and suctioned out all the blood, and I had like a tunnel of air come through my nose for like 30 seconds. It was the most glorious 30 seconds of 8 years of my nose. And that was it. I immediately was just gushing with blood. And he said that in my surgery that I had a lot of blood. And so, and so he said that this would be a problem, that I would continue to have blood, but just to keep doing a rinse. Now, that was the first time I had heard to do a rinse. I didn't know what he was talking about. And so he suctioned the blood out. I had to wait in his office for 15 minutes to let the blood stop because it was just clots and crap running out my face. And finally, I am able to leave, and I still had to wear this because I was still bleeding pretty badly. And I get to the receptionist, and she's like, okay, are you doing rinses? I'm like, nobody has told me what this rinse is. And she gives me this like flyer thing, and she's like, oh, it's just this. It's like a neti pot thing. That's all this rinse was. She said to use this kind, not the pot kind. And so basically you take distilled water, not purified and definitely not tap water, although there is a way to do that, but don't even mess with it. This is $1, no big deal. This was $10. So you fill it up, and then you get these saline packets, which this was $13 for 100 of them at Walgreens. And you put the water to this line, you put a pre-measured saline packet in it, and mix it up. I microwave, because I don't know what I was thinking. I put the water in the refrigerator, the first gallon, and then I would microwave it for 60 seconds to make it nice and warm, and that felt good for me. However, you could just, the second thing I left on the counter, and now I only microwave it for 15 seconds, and that's a little cool. I like the 60 seconds better, but that's way too hot if it was just regular. So probably about 15 to 20 seconds would be good. And then I rinse my nose. I do it probably 5 to 7 times a day, depending on if I'm home or not. And you just basically shove the water up one side, and you have to tilt your head over the sink. You tilt your head like this, you stick it up one nostril, and it comes out this other nostril, and then vice versa. And I do about half a bottle on each side. I go about a quarter bottle, quarter bottle, quarter bottle, quarter bottle. Now, this right nostril is still having, to this day, even just an hour ago, big gross blood clots are still coming out of this side. And what's crazy is I was noticing my face is deflating over here. And so it obviously, the entire week that I didn't do this, none of this was moving. And now that I'm doing it, I can feel that this side of my face is deflating and this side still feels hard. And what's crazy is when I do it, nothing comes out over here but water. And I know this nose is so full of scabs and boogers and blood clots and all kinds of crap, it won't budge. And my face is hard from it. But this side is now softening, and on occasion I can actually bleed through my right nose, but you know, nothing good still. The headache is still there. This is not really helping with that. I know a lot of it has to do with my glasses, so I'm not sure when that'll ever get over it. But I do it, like I said, 5 to 7 times a day. Nobody can explain to me why nothing is coming out over here. I sent another message to the doctor saying nothing is moving on my left side, and no response, so no surprise there. And then last night I went on to try to see if there's anything else I can do just for regular nose surgery. Like, what else can you do? And there was this one doctor that only had first off, this one video, this one guy had this kind of the same surgery I had, and no packing in his nose, whatever. I was so jealous. And then this other video, it shows the doctor removing the girl's packing 1 day after surgery. Like, why did I have to have 7 days of packing? That was definitely the worst part of it. And I had to take pain medication and double it up with ibuprofen. So I was taking the Percocet and ibuprofen alternatively every 8 hours, which I guess I could have taken it every 4 hours, but I would go 8 hours Percocet and then 8 hours. So I was only taking 2 Percocet, 2 to 3, depending on the amount of time it was a day. But now I'm not taking anything other than Tylenol for my headache. But anyway, so I checked out a video last night, and the doctor said to clean it out with peroxide, that sometimes it'll take 20 Q-tips of peroxide and just wash it out to where you finally get a clear margin in there of no scabs and all that kind of stuff. And then you line your nose with Neosporin or, you know, some sort of antibiotic ointment. So that's what I did last night. It didn't help me breathe at all. I still cannot breathe through my nose. And he also suggested that you need to spray your nose with this oxymetalazine. And a generic was fine. He said spray, and it was because it reduces the blood vessels in your nose to kind of curb the bleeding. And so I haven't noticed it work yet today because I'm still having clots coming out of this side, but I haven't been dripping any blood or anything. And I know that for the past 2 weeks for a week that I took the ibuprofen, that's a blood thinning agent, and that's probably didn't help much with my bleeding, but it was the only way to bring down swelling and then have the pain medicine work at the same time. So that is that. I am 2 weeks and 3 days out. I'm not saying, what I am going to say is that it was worth it for that 30 seconds of air. That if that's going to eventually happen and I can breathe through my nose with these big old nose holes now, that 30 seconds was delicious. If that can ever be replicated with my nose finally working again, it will be worth it. At this point, I'm still miserable. I am cranky. This is one of the worst surgeries I've ever been through. And I've had open heart surgery. I've had a hysterectomy. I've had more than 30 surgeries, and this is top 3, I would say. It was bad. So anyway, hopefully it'll be worth it. That is the update, 26 minutes. I'm sorry to have wasted all you guys' time, but if any of you are interested in, finding out what happens with turbinate repair, that is what I've gone through. Maybe you have a different outcome. Maybe you could tell me I have something to look forward to, and not look like this. Like I can't put any makeup on my face because it's sore. And in fact, because my nose was so stretched out, about 3 days ago, on Tuesday, I tried to put makeup on my face, and I tried to put a foundation on, and it was really tender and sore. But as I was trying to do it, it wasn't even setting on my nose, and I'm sure it's because my skin was so stretched out. And so I'm using copious amounts of moisturizer to try to fill in. Like it was so stretched out, you could see like pores. Like my pores were like like this. They were so big. So anyway, thank you so much for watching. I have an update on the 23andMe that I needed to still do, and I also have Ipsy bag coming and Target Beauty box coming, and I did a bulk, which is a kind of like a return product kind of video that my cousin ended up buying, and I did a video of that, but I didn't want to show my face. So I've got a lot of videos coming to you guys. I just haven't done it yet. Thank you so much for watching, and I will talk to you guys soon.